In insurance, there's several terms that you need to know specifically that relate to insurance, and um, these are used very often. So it's really important that you know the terms. A policy is something that's purchased by um, a person or a group, maybe that is an agreement between parties that under certain situations and conditions that this person will have financial coverage uh, for their care, and then there's limitations and rules at which they will cover or not cover. Cost sharing. Most policies now will require that pretty much all parties will share a part of that expense. It'll be a part the facility may actually be sharing part of that cost by writing things off. The insurance will share part of that cost by saying, we will cover this much of that charge. And then, of course, the patient, at the end of all of that decision between those two parties, will have an amount that they are responsible for also. Insurance includes deductibles, and one of the terms that we have to consider. It's the amount that has to be paid up front by the policyholder before the insurance company pays anything for their services at all in that usually calendar year. A co-insurance is, um, in this case, and a lot of policies will have a deductible and a co-insurance. That means that uh, they have the deductible, which is the amount that has to be paid up front before they actually cover anything. And then the co-insurance is another percentage a lot of times of what remains that will be another part of what the person who has insurance is having covered. The co-payment is the amount paid to the policyholder or from the policyholder for each visit. And in this case, it is you have that copay of, let's say, $25 to be seen. You have to pay that amount each visit to be seen in that particular facility. So, regardless, you know you're always going to pay that $25. Federal government requires that at least 10 categories listed as essential health benefits have to be covered in some part or to some degree. Those are ambulatory services, services that patients may have in a healthcare facility, maybe an office, it may be a place where they can go in and have a test done, and but it's patients that are not admitted. Then hospitalization, of course, that's going to be the patients that are admitted to the facility and certain benefits it covers there. Mental health and substance use disorder, it has to be covered in to some extent in this area too. Prescription medications, um, there has to be some level of coverage for medications that a patient will get, and that's going to vary widely depending between insurance companies. Preventative services, those things that keeps us from getting ill, and wellness services uh, are considered to be essential because it's going to keep us healthy longer. So we are going to be managing our healthcare longer and better. Emergency services, that would be our urgent cares and our ERs and so forth. Uh, it also requires some maternity and newborn care is included. And then again, those are under certain conditions. Rehabilitation and habilitation services or devices. So things that helps the person to manage sometimes. And a lot of times it's a temporary thing until they get back to full recovery. Sometimes it may be something that is more permanent. Laboratory services also has to be covered to a certain extent. And pediatric services as it would apply, including oral health and vision health has to be included. Two types of health insurance plans in the US, and that is government based plans and private insurance plans. And also in under coverage rules is there has to be medical necessity, and that is, or it has to be medically necessary. That is saying that what this person was seen for and what they are diagnosed with basically match. In other words, for what you saw this patient for, you listed a diagnosis. The services that you provide in that visit has to go along with that diagnosis. Elective procedures is another thing that's considered. These are procedures that are not medically necessary. And in some cases, that may be the insurance doesn't cover them at all. It may be a limited coverage. But these are things that are optional or what we call elective because they aren't absolutely mandatory that they haven't done, but it's something that the patient wants done. There's a number of preventative care services that are also included, and more recently, uh, they are included at a much broader level. And this is only a small part of the preventative services that are considered covered. And in a lot of cases, these have been covered for a number of years, but this has become a much more of a focus in the last few years. Alcohol misuse screening is one of those. Um, Basically making sure what level of alcohol use this patient particularly has, because that applies to a lot of physical problems that a patient might have. Blood pressure screening, um, cholesterol screening, those of course are making sure they're staying stable levels. Colorectal cancer screening, making sure that patients don't have something developing that maybe they're not even symptomatic for. So it's something that prevents a much worse problem in this case. Um, Depression screening. Uh, Sometimes patients may not realize their own level of depression. So there's a lot of question and answer things that goes into that one. Diabetes screening, again, making sure that patients are managed, or that it is determined if they have an issue with elevated glucoses. Diet counseling, and this could be for any number of reasons. It might be illness related, or it might be simply being in better health related. Hepatitis B and C screening, especially whenever you work in healthcare areas or if you have patients that might be potentially of higher risk. HIV screening. Again, we don't do this on all patients, but if there is a potential concern about those things, then you do. Immunization vaccines, and these are done, of course, on our younger patients as a scheduled event, but we also have annual influenza injections and so forth. So making sure we know where our patients are in that category. Lung cancer screenings. We know this is one of the most high cancer issues in our country. Um, so it's important to find those early. Obesity screening and counseling, because obesity is another thing that tends to lead us towards unhealthy bodies as a general rule. Tobacco use screening. This is, you can do a number of things in this area, um, but it's determining what is their level and determining maybe in a treatment plan with them, maybe are those levels changing. Transmitted infections, prevention and counseling. We look at this probably more primarily for our younger patients, but sometimes it's useful for patients who are maybe not quite as young. But this is helping. Uh, it is monitoring them. It is sometimes educating them. So there's a lot of aspects that might go into that. When we talk about government plans, we're usually talking about things like Medicare, Medicaid, TRICARE, which is military-based insurance. Um, the government provides coverage with reduced or no monthly premium for persons that are indigent. That's probably going to be more the Medicaid group. For people who are elderly, which would be more Social Security. For the military group, which is going to be the TRICARE, and also for government employees in general. Um, It also may provide coverage for spouses or dependent of someone who is a veteran who died in the line of duty, and it's covered under what's called CHAMP VA, which is an offset of TRICARE. They need to have certain points to qualify. They qualify by age in some cases, especially in the cases like Medicare, by income level that may relate more to Medicare. In that case, they aren't covered after a certain amount. By government occupations, people who maybe are individual persons who work for the government, so private persons who work for under the military. So um, they have military based insurance. And it may be also dependent upon the health condition of the person. So patients at least 65 years of age can qualify for Medicare. And then if they have a low enough income in Medicare, then they may be also eligible for Medicaid. And then in TRICARE, it's going to be dependents of someone who has been in the military, typically. Medicare provides coverage for persons who are over the age of 65, someone who is disabled, unable to work, and patients who have been diagnosed with end-stage renal disease. So patients who are considered terminal, if they're terminal within a certain time frame, may qualify, but yet some may not. And there's potentially four parts of Medicare. One is Part A, and that is for when someone turns 65, they are eligible for inpatient healthcare coverage under um, Part A. Under Part B, that's going to relate more to office visits or things that are done outside a hospital setting. So these are routine, what we think of as routine insurance care that is not an inpatient base. Part C is an insurance level that looks more like a general insurance and not so much as a federal insurance. It allows them to have a little bit different benefit coverage, um, but it has to cover everything that would be included in Part A and Part B. And then Part D is prescription coverage. So they are eligible for medications under Part D if they have it. Looking at Part D of Medicare, this is again our outpatient office visit type of care. And once their deductible has paid, their upfront amount is paid, then typically it will cover 80% of what remains. Um, this is based on what's called a resource-based value system, and you'd want to remember that scale. And in that scale, it's determined by three different parts. What um, work that the provider has to do? How much care are they giving to that patient? It also is based upon the liability expenses of the provider, and it's also based upon what their overhead is. In other words, what's their cost of doing business? Maybe their rent, maybe their utilities, and those kind of things. Those things can all be a part of the factor of determining what the payment scale is for that coverage. Medicaid is another branch of federal plans, which are typically those patients who, and the terminology is indigent, but basically it's patients who, for whatever reason, cannot afford insurance or or basically have a very limited income, a lot of times to afford anything. But that's the terminology is used as indigent. It's funded under the federal and state government in this case. It's covered in all states in the U.S. And D.C., but the programs can be very different from state to state, mainly because of the state part of that coverage. Um, there is a list in your textbook that will kind of show some of the mandatory benefits of Medicaid. They are the payer of last resort. And what that means is if a patient has any other type of insurance coverage, then that insurance will pay first before Medicaid is billed. So those that are like And it is possible to have a private insurance and have Medicaid also. But in those cases, private insurance is going to always be billed first and then Medicaid. Um, Again, the terminology there is payer of last resort. You would want to